Assalamu alaikum, everybody. My name is Iltifat Hamzavi. I'm a board member at the Michigan Muslim Community Council. And as part of a series of webinars, we're doing different topics that will hopefully help you cope with the various challenges of COVID-19. Inshallah, our hope is to provide support to every community through the regions. This webinar today will be shared both with your community members and the Imams Council. With me today is Sister Nagmana Siddiqui. She is one of the experts I go to within the human resource space. She has worked at Fortune 500 companies. She also presently heads up HR in the HR department at the UAW. She's also highly educated in HR policies. And although she's not an expert in every domain of HR, she can point you to the right resources. So Nagmana, welcome to our session today.
Thank you so much for having me.
So Nagmana, I wanted to kind of have you walk through what happens in our community. Unfortunately, due to the pandemic, many people are furloughed or have completely lost their jobs. And then we also have issues of people who may get sick while they're working. So if you could maybe start off with a couple of topics that you think are appropriate, maybe,
sure.
Go through a process and you can kind of let us know where you want to go with it.
Okay, sure. Thank you. Well, first, I'd like to start off by talking about the couple of acts that had been passed by the Trump administration, the government. The FFCRA, which is the Family First Corona Response Act, signed into law March 18th and effective April 1st. And then the CARES Act, I'm sure people have heard about that, the Coronavirus Aid Relief and Economic Security Act, which was signed into law March 27th. The FFCRA provides for paid leave provisions and emergency family medical leave and expansion act called the EFMLEA, which I'll touch on in a few minutes here. And then the CARES Act, as people may have heard, incorporates the various sectors of the economy, including individuals, big businesses, small businesses, public health, there's an education domain, and local and state governments as well. So those are two key acts that people should be familiar with. There's websites as well pertaining to those acts that people can reference, either on the DOL websites, dol.gov. And then if they go to agencies and they look for the pandemic and FFCRA, they can access some key resources there as well. So I just wanted to touch base on those acts at first, and so I'd like to talk about COBRA coverage, touch base on the unemployment piece, and paid leaves as well. So we can start with the COBRA coverage.
Okay.
If you like, okay.
So COBRA, just to kind of remind everybody, occurs and kicks in, I guess, when you have lost your job and you need insurance going. So yeah, let's walk through that one first.
Yep, COBRA, that stands for actually the Consolidated Omnibus Reconciliation Act of 1985. So that was instituted at that time. Yeah, people are like, what is COBRA? And like you said, Iltifat, it is when you have a qualifying event, such as a job change, job loss, you could be laid off, you could be terminated, whether voluntary or involuntary. You could have a reduction in hours, work hours at your workplace. You could also have a change in status, like changing your dependent status. Your child might be turning 26, and so they would no longer be covered on your health insurance. You could have a divorce situation or legal separation. That's also another qualifying event for COBRA. So generally, you have 45 days after the qualifying event to sign up for COBRA coverage. And the DOL actually recently extended that time frame by including what they called the outbreak period to incorporate the COVID-19 period. So they instituted what they've called the final 60-day rule. So that disregards the overall outbreak period. So for example, if you apply for COBRA April 1st and the national emergency ended April 30th, So this final rule will disregard that outbreak period and extend the COBRA coverage by 60 days. So really, the person would have until ultimately August 28th to apply for the COBRA coverage, because the 60 days would go out to June 29th, and then it would be 60 days from there. So the government really did apply, some provisions for the COVID virus in extending that time frame.
So Nirvana, if I could just kind of go back to that. So somebody has their hours reduced or they're furloughed.
Mm-hmm.
That can happen anytime between April 30th and June before
really April 1st.
April 1st?
Yeah.
And when does that end?
Well, it's all dependent upon when the national emergency is deemed to have ended. So it would depend on the state. Now, our state, Michigan, we're still under a stay-at-home order. So I would say through May 28th, that period would be the gauge for Michigan.
Okay.
The example I used stated April 30th. That was just an example, but we would use for now May 28th, unless of course Governor Whitmer extends it again.
Okay, so up until as of right now, May 28th, you get furloughed. Then COBRA will allow you to continue your health insurance for how many months after the emergency period?
So really, it would go through September. I would say end of September.
So 3 months from whenever that point is. Okay.
Right. Yeah.
And is that 3 months for whatever coverage that you have right now with the employer?
Right. Okay. So yeah, COBRA continuation coverage is whatever coverage. It's the same plan as the company's existing healthcare plan. That includes your qualifying beneficiaries or dependents as well.
Okay.
There's other options. I wanted to mention there's other options besides COBRA, because COBRA can be very expensive. Okay. Much more expensive than what you would pay for your normal plan. Mm-hmm. So what we would suggest normally to employees is to also check out the health insurance marketplace. And for that, you can go on to this website, www.healthcare.gov, and check out the more affordable healthcare options. Also, you can find information on the DOL.gov website with respect to the ACA. So the ACA is Affordable Care Act, and again, the health insurance marketplaces are a part of that ACA. So with that, though, you have to pay attention to the special enrollment periods. So they could be different times, and if you don't hit the enrollment period, then I don't believe you'd be able to sign up in that case. But it's always good to go to the website and compare the costs anyway. And people can find out if they qualify for Medicaid. There's a series of questions, survey questions that are asked that you need to complete in order to find out if one qualifies. But factors to consider when looking at all of this, whether it's health insurance marketplace or COBRA, is to look at premiums, the cost of premiums, the network providers, the cost share, whether the employer might provide in their severance package some type of cost share for the COBRA. Sometimes that happens, depends on the company. Your drug formularies, how that impacts, how the healthcare will impact your medication costs, and the service areas, because that all sometimes is an issue as well, of the different types of service areas for COBRA. So
so you get unemployed or you're furloughed. Now you decide you want to get healthcare. You have the option of using COBRA. If you have enough money to pay for it, that'll keep your exact same coverage going.
Right.
You can't, and that also includes deductibles, and copays are all covered right now for telemedicine and for most visits during this period of time. So that's good to know. But if you don't have the resources to pay for the continuation of COBRA, which will cost you some money, you can also go to healthcare.gov and look at options over there.
Yep, through the ACA. Yep, exactly. You got it.
Great. Okay.
Yep.
That's wonderful. Anything else on health insurance that people should be aware of?
Yeah, there's also, different websites from different, from various healthcare providers. For example, United Healthcare has a great website. It's uhc.com, talks about short-term healthcare insurance coverage. So if you just need healthcare for like a short amount of time, you can get such healthcare typically like the day after you apply for it. And then the maximum amount of time for short-term healthcare is 12 months. So if you're just looking for something short, you know, in between jobs, you can check that out as well. I'm sure Blue Cross Blue Shield has similar programs. So that's another aspect of healthcare I wanted to talk about.
And Nagmana, how does this short-term health insurance compare to other programs? Are there limits in coverage? Are there limits in networks?
Yes, there's some limits in coverage, and sometimes, well, I've read that it doesn't cover pre-existing conditions is one thing.
It doesn't. Okay.
So yeah, that's the main difference. It's more streamlined type of care for, you know, someone's generally healthy and no pre-existing conditions, and whereas Cobra and the marketplace covers more broadly and comprehensively.
Now, do these websites have different options? Obviously, Arabic, Bangla, Urdu, and some of the West African languages are also things that we have to be aware of in our communities. Is there a resource for somebody to translate those or use those?
Through the healthcare.gov website, I believe there's Spanish options. However, I don't know if there's options for various languages like Bengali or Arabic and Urdu and those types of languages. I haven't seen that.
So members of our community can also tap into Access if they need support for the Arabic language options. And the Health and Human Services section at the state may also offer some resources. And then if you really can't find any options, please contact the MMCC email page, and we'll try to find resources within your own communities of various languages. So thank you. So that was very helpful. Anything else on health insurance you think we need to cover?
No, I think that does it for now. Yeah.
Okay. So now you're furloughed. How are you going to pay for groceries? How are you going to pay for food? How are you going to pay for your home? Any ideas on the unemployment claims and how to walk through that process?
Yeah, we can walk through the unemployment claim process. Like I said before, the CARES Act has allowed for some additional flexibility for the state and local governments with respect to unemployment insurance and the funding for the insurance. There's additional funding available. The $600 a week for the government, from the federal government, is another good economic way to assist employees that are furloughed. What I wanted to mention too initially was the fact that I believe he's a doctor, Dr. Stephen Gray, is the director of the Michigan Unemployment Agency. And currently they're running on Facebook through the United Way, great virtual town hall meetings every Friday at 1 o'clock. There was one yesterday, there's one next week, and I believe there might be a couple more after that. But those are very informational seminars that include Q&A. So I encourage people to check those out through Facebook if they have Facebook. And even if they do not have Facebook, check out the Unemployment Agency website for important resources as well.
So to that point, there has been a nice handout generated by Dr. Tayyib Jukaku and his associates on unemployment, and he's one of our board members. And MMCC sent this out as an email to our communities, but again, for the Imams Council and the local communities, you can look through that. And on the second page of it, it has a picture of Stephen Gray.
Great, yeah.
Video linked to that handout, and it can talk about unemployment benefits. It talks about how to file a claim. And then it also talks about how to apply for the specific pandemic unemployment assistance that Sister Nagmana Siddiqui is speaking to. And then it walks you through how to claim the unemployment benefits, as well as all the benefits that you will receive during this difficult time. So Sister Nagmana, can you speak to this section of the handout? I guess there's a video right there that they can use, but anything specific that they should watch out for over there?
Well, I was able to view the website, the town hall yesterday as well. They went through some important points with respect to filing claims. There's obviously been a dramatic increase in the last few weeks for claims. Unemployment rate, as we saw yesterday, was 14.7%, historic high, with about 23 million unemployed right now. It comes at a time where we were at an all-time low for unemployment before all of this coronavirus situation, pandemic situation happened. So what he mentions on the town hall, Mr. Gray, is that the eligibility rules have changed with the executive order. People now are waiting for up to 6 weeks trying to get their payments lined up. Their staff is working overtime, he mentions. And once they determine the eligibility and the eligibility requirements for an individual, they backdate to the date that they last worked. So he mentioned that there were some phone line issues. So the way you can apply is either how to file a claim is either through a phone line, through the website, or through I believe you can go to the agency itself in person, he said. So the pandemic unemployment assistance also applies to self-employed individuals for 1099 employees.
Oh.
Self-employed individuals, but there has to be a threshold salary level that they need to meet. So they encourage you to go to that website, dol.gov/coronavirus/UE-insurance, and check out the rules as far as the eligibility criteria goes. You have to answer a series of questions and prove how your income has been reduced due to the virus itself. So, and then you would receive from up to $160 to $360 per week from the state, and then the additional $600 per week from the federal government.
So, Mr. Nagmana, so that $360 per week from unemployment based upon your status as a 1099 or a regular employee. And 1099 for our community is when you run your own business or you're independent contractor. Right. And as Sister Nagmana knows, we're one of the most entrepreneurial of all communities. A large percentage of the businesses in Michigan, way above our population, are run by Muslims. But many of those independent companies have been hit. Our meat stores, our cultural venues, our consulting areas for fashion and hijab production are all affected. So those are things that we can work on. So if somebody claims those, they can get $360 per week from the state. They get $600 per week or per month from the federal government. What's the number there?
$600 per week.
Per week. Okay. So you effectively get $960. And is that per person in the household?
Per individual that is unemployed, right?
Unemployed. Okay, got it. And so, so that will cover you for that period of time. How long does unemployment last for, and how long does the federal government numbers last for?
The length of time for the unemployment, generally, I thought, I'm not certain on that piece of it. Okay.
So it's something that people can go to the website and check how long it goes for. And then, and then the federal government assistance is dependent on when the federal government declares an end of the emergency. Is that correct?
Right.
Okay.
I believe that's correct. Yeah, I believe the time frame is like 26 weeks, something like that. But I don't know if they've increased the time frame for unemployment insurance. Actually, so we have to work on that.
So I think just to our members of our various masjids and congregants over there, please, this is a bridge to your next position, but unemployment and federal money does not last forever. Right. So now you could be making $960 a week, which might be more than what you're making at your regular job. What happens if your job opens back up? The auto companies are opening up, I believe, this week. Is that correct?
Next week, yeah. Some, it's dependent upon the company, but yeah, I believe they're staggering shifts and gradually getting people back to work in the manufacturing sector. Yeah, the plants, auto plants. Yep.
So what if you get called back to work and you're worried about the environment? What are the employers doing to try to make sure that our community members are safe when they go back to work if they are called back to work?
Yes, and my company actually has been talking about the effective work, return to work, and plans for that. And there's certain criteria that the companies need to meet through the executive order. They must provide proper PPE, such as face masks. And our company is, or organization is ensuring that's happening. We need a proper or appropriate preparedness response plan. Protocols for minimizing risk. That's important to determine what to do, whether to have like isolation rooms or configuring our cubicles to meet the social distancing guidelines, preparing for employees' effective return by staggering shifts or alternating shifts with employees. We've determined that we don't want a full workforce back into our workplace right away. So we're going to be likely staggering shifts. Things like screening as well. We were proponents. We actually did some screening this week of our employees, coordinated through Beaumont Health System. That was very successful. Screening for diagnostic COVID testing as well as antibody testing. We did both actually. So just to establish a baseline. I know it's earlier on and executive orders through May 28th now, but so things like that are important. And as far as returning employees to work.
So if you are an employee, then you have these options. If they call you back, you can ask for protections to make sure that your workplace is safe.
Right.
Okay, great. So we've covered healthcare. We've covered unemployment and how to apply for that. The duration, the amount of money to expect. Anything else you want to add to unemployment?
No, I think I think you covered it well. That's great.
Okay, what else do you think is important for people who are going through challenges with their HR or job prospects at this moment in time?
I think with respect to sick leave and whether people get sick at work, we can talk about that, how we should handle that, what kind of documentation is required. So an employee, let's talk about that. So an employee
I think a couple of shout outs to our community. We were one of the first religious communities to shut down. During the holiest of months, during Ramadan, the Imams Council of Michigan stood uniformly against opening masjids up, mostly for the public health. I want to give a shout out to our Imams, 1,400 years of history they had to take on. And they went through every religious scripture, every analysis of that to make a decision not to open the masjids. And as far as we know, the largest masjids in Michigan have not reopened, but they have done so many wonderful things for our congregants to do virtual visits. In addition, I'd like to plug our Eid program. The MMCC will be hosting and sponsoring a Eid TV Day celebration on WXYZ's affiliate Channel 20. And you'll be able to watch Eid programs. There'll be a khatira, not a full khutbah, but a khatira on there, led by the chair of the Imams Council, Imam al-Masmari, and our chairman, Mahmoud al-Hadidi, will also be offering comments. And then every community in our area will be offering videos from their youth, from what they did, and all the special flavors that make up our community. So we want to celebrate that moment. So celebration to our masjids, many of them who took on significant economic challenges. Our schools took on economic challenges. So just wanted to share that. So with that, let's bridge over to the next topic.
Great, thank you. So I wanted to talk about paid leaves for a minute here. So what does an employee do when they have symptoms of COVID or they feel that they either can't return to work or they're sick at work? So what kind of documentation is required? So we know that an employee can take a leave under the FFCRA, the Families First Coronavirus Response Act.
Okay.
And they may be required to provide to the employer evidence of like a doctor's appointment or just prima facie evidence that they're feeling ill, but they don't necessarily have to provide specific documentation, medical documentation, that they, are actually undergoing treatment, because the point is to have them take a paid leave. They can take a leave up to 80 hours, 2 weeks. And just note that that is for companies of less than 500 employees. This paid leave is available through this FFCR Act. So they can take a paid leave, and this extra documentation is not required, because the point is to encourage them to take the leave, especially if they're feeling ill and they suspect the COVID diagnosis. But prior to returning to work, employers can mandate under the law an employee to return with a negative test result of COVID. They should take a diagnostic test, the swab test, and provide a negative result. And that's what we're doing with the UAW.
So if I can go back to that for a second. So first off, somebody feels ill, and if they're diagnosed with COVID through a test and they don't have to offer any other documentation, they can stay back for 2 weeks. Is that correct? They don't have to.
Yes, for employees with employers that have less than 500 employees.
Okay.
With that is with the paid leave.
Okay.
Without
so paid leave, you don't have a doctor's note. You just tell them that you can't come in, you're not feeling well, and that's all you got to say.
Right.
For up to 2 weeks.
For 2 weeks, yeah.
And you get paid during that time.
Right. Yeah.
Got it. Okay.
For 80 hours, yeah.
Okay. And then the next point about some employers are requiring negative COVID test. Who pays for that?
Well, the employer, if they're self-insured, which means they pay the direct cost of the insurance for the employees, the employer would pay for that. And
I just want to remind people in our community, the cost of COVID testing as of right now is free and is paid by the federal government through a variety of plans. So in general, if somebody starts charging you for a COVID test, ask questions about it, because your employer or the government should be paying.
Or the government, yeah. If the employer doesn't pay, like you said, the government would, assume the costs. Right, okay. Exactly. So yeah, there should be no cost for actually either the antibody test or the diagnostic test.
Okay. So, and then just to throw my medical hat on, having an antibody positive test does not mean that you cannot get reinfected. We don't know for sure right now.
Right.
And then there are different levels of sensitivities of these tests. So sometimes your test can be negative, but you still might have it. Now, if it's positive, almost for sure you have it. And so, but being negative doesn't always mean that you don't have it, because the sensitivity, which is the number of chances is positive, isn't as high as we want it to be. It's getting better, but it's not perfect. Okay, so
yeah, I've also heard of a situation where you could be positive for antibodies, had been positive for COVID before, and are still positive for COVID now.
That's correct.
But you're COVID positive now, but then you're not contagious now? Is that?
Yes.
That's what I heard.
So if you're COVID positive, they're checking to see if you're shedding. That shedding period may not be active, but I think most of the medical recommendations are that if you're COVID positive, you cannot go into a workplace until that clears, because we're not sure how long you're shedding for. Now, in special circumstances, and you have to talk to your doctor, you might be positive and it may not convert back to normal, but you're not infectious to people around you. And the question is, if you go back to work and you contaminate people, and just in general, the places that are contaminating people are poorly ventilated workplaces. Large manufacturing facilities are not well ventilated with too many people. Secondly, it is also occurring in closed indoor sports arenas, and then religious environments or funerals where we have, again, limited circulation, lots of people. And so in general, when you go back to work, you have to check the ventilation. You also have to make sure people are enforcing the number of people in your facility. And then in general, you should probably mask up as much as you possibly can, because that will also reduce your risk. So, okay.
Okay, thanks.
Great.
So yeah, getting back to the Emergency Paid Sick Leave Act, which incorporates the employers with fewer than 500 employees. That does not distinguish between full-time or part-time employees. So you could be a part-time employee and also receive the sick leave. Also incorporates a dual employer relationship. So if the employer has contract employees, for example, either the contractor would be the employer, or the place where they're working as a contract employee would be the entity responsible for providing of the sick leave. So it depends on who controls the work primarily. So who is responsible for the hiring and firing of this employee is who would be responsible for implementing or providing for the paid leave. So that's with regards to a dual employer relationship there.
So can we sparse that out a little bit? So you've got employer,
Mm-hmm.
and so the employer is responsible for the paid leave if you're a regular W-2 employee. Is that correct?
Yes. Yep. Employer is responsible, right?
Okay. Then
if you're regular W-2 employee. Mm-hmm.
Okay. Now you made a distinction between the employed people with the W-2 and then the individuals who are 1099. Is that the distinction that you're making there?
Well, more so of like, for example, if you had an agency employee or contract employee from a company like Kelly Services, to throw out example. So who is the employer? Ford Motor Company or Kelly Services? And in that case, I would say it's Kelly Services, even though you might have a Kelly person working for Ford. The hiring and firing responsibility is a responsibility of Kelly. Okay. So they would have to be responsible for the paid leave. Now, in the case of a 1099 employee, who's directing the work? You're directing the work. Mm-hmm. So you would be responsible for that paid leave for that particular employee. Right.
Actually, we have many members of our community who are new Americans or on a immigration status who are employed through these agencies. So in that situation, the agency would be responsible for their paid sick leave.
Okay, right.
Got yes.
Yep.
Especially in the IT sector and manufacturing and engineering sector. Okay, that's very helpful to know. So you got to know who your employer is.
Right, exactly.
Ford, you may not be working for Ford, you might be working for an agency. The agency has to make sure they take care of it. But they are mandated to take care of your paid sick leave during this time. Is that correct?
Right. If they are an employer 500 or less.
Okay.
Now, for employers of 500 or more, I think those provisions are still being worked. It depends on the company, really.
Okay.
They may be able to provide you with a leave. Most companies with 500 or more employees have a leave program. Okay. And whether it's paid or unpaid, most of the times they have both provisions. I believe for coronavirus, we're going to take that into account, obviously, given it's a unique situation. So, but it's not mandated for the those large corporations to provide that type of paid leave. So that's a big difference between the smaller companies and the larger corporations. So the other thing I wanted to mention under this Emergency Paid Leave Act is the childcare provision. Oh, okay. So it does state that if your childcare provider has closed, if it was like a daycare, it's closed, or if you had a provider that no longer can, provide the childcare services, then you would be able to, I think, take advantage of the paid leave provision as well.
So if you're caring for your parents, you're caring for your children, which is a basic dictum of our faith. And Wama Ufin, don't even say anything towards your sick parent when they're ill because they cared for you. And then if you have to take care of your children, then you're allowed to apply that. And is there a timeline for that? How many weeks can you take care of your sick family member?
The timeline for the paid sick leave still is the 80 hours, the 2 weeks. 2
weeks. Okay. Yeah. So tell your family you only get sick for 2 weeks, and then after that, they have to. Okay.
Right. It's only a couple of weeks, and there's also like caps to the amount of total pay that they'll provide to you as well.
So what happens, because many of our communities are frontline workers, and some have become very ill with this, and they're not recovering in 2 weeks. Many of them can barely walk after 2 weeks. So what do you suggest in that situation? That you're the caretaker, not the person who's ill.
Yeah, I would suggest trying to maybe see if you could get an extension of that. I don't know if the government is going to be open to that, or if the leave, if there are provisions for extensions. But I would suggest checking out the DOL website or contacting the DOL
Okay.
for additional information on that.
This is the state of Michigan DOL?
Yes.
Got it. Okay.
DOL.gov, yep, /agencies, and wage and hour department, pandemic, FFCRA questions.
So
There's a lot of information.
Is that a state of Michigan website? That sounds like a federal website, or is it?
That is an actual federal website.
Okay. And they would say the state of Michigan within.
I think you can, yeah, specify for the state as well.
Got it. Okay.
Yeah.
Okay. The DOL.gov is a great place to go to get more information about these healthcare benefits for people who are caretakers, as well as if you need any paid leave due to your own health. So excellent. Okay.
Yeah.
Anything else that you think we should cover at this point, Sister Nagwana?
Did you want to cover the EFMLEA?
Yes,
the
please.
Emergency Family Medical Leave and Expansion Act?
Yes, please. That would be very helpful.
Okay. So with that, you can use for the care of a child whose school or place of care is closed,
okay,
or due to the virus, or if the child care provider, again, is unavailable. It's up to 12 work weeks, again, of job protected leave with continuation of healthcare insurance. And this is how it works. I guess the initial 2 weeks is unpaid. It's unpaid care. So yeah, this is an additional aspect of the FFCRA actually. Okay. So the initial 2 weeks are unpaid, and then the remaining 10 weeks are paid at 2/3 of the employee's regular pay rate. Okay. So again, the eligibility is less than 500 employees, and you have to be employed with the particular employer for at least 30 calendar days. Okay. And it's for private and non-private sectors. Public agencies, if you work for the federal or state government, they're covered regardless of how many employees they have. Okay. But for this leave, you can't take more than 12 weeks, just like the FMLA. So FMLA is more so unpaid leave, whereas this particular emergency leave is partially paid as well. Okay.
With all the schools closed down, it's a real challenge for our parents and families to take care of them. So especially with younger children. So this would be the provision that would help them get through that.
Right. Yeah, this would be a good provision.
And how do they find more information about the Emergency Family Leave Act?
I would check out, again, that website for the under the DOL.gov website.
Okay, got it. So DOL.gov. Okay, that's excellent.
Yeah.
The many parents are dealing with that. I know it's not perfect. I know that the school is going to be closed up until the fall now in many districts, and they have online learning. But at the very least, they have this option to kind of reduce some of the discomforts.
Yeah.
Well, thank you so much, Sister Nagwana. We covered unemployment. We talked about COBRA. We talked about paid leave for your own health issues. We talked about paid leave for caring for a sick relative. We talked about paid leave for caring for your children who are out of school. Thank you so much for this opportunity.
I hope it was helpful. Yeah, thank you so much for setting this up.
No, it's a pleasure.
It's an opportunity.
To have this expertise. That's incredible. And at this point, you can go to DOL.gov and you can find some more information. And again, we will work on getting translations for the communities that need that. Also, I will remind people of our community that there are various food banks available to every Muslim in the community. Brother Abdullah Sheikh and our chairman, Mahmoud Al-Hadidi, have been leading many efforts to help feed our community and provide sustenance at this time. In addition, Sister Christian Zayad and Brother Mitchell Shamsuddin have also been organizing efforts in the same areas within the Muslim Center and other communities. We also have programs for the elderly to make sure that they're supported in this time, especially in the city of Detroit. And lastly, if you're interested in hearing about how to protect yourself legally, eviction notices, paying your mortgage, things like that, Today, later on, the legal team led by Tariq Hafiz, Al Dodi, as well as our accounting team, and Muhammad Khalid specifically, will be advising you on how to deal with those issues, as well as for business owners, how to deal with PPP. So on behalf of the Michigan Muslim Community Council, my name is Iltifat Hamzavi. I'm a member of the board. I wanted to especially thank Sister Nagmana Siddiqui for her incredible expertise and decades of work in this area. And thank you so much for your time.
No problem at all. If anyone has any questions, feel free to give them my website, my email, and I'd be happy to help out wherever I can. Everyone, I just wish everyone happy Ramadan, and stay safe, stay healthy, stay strong out there. So thank you so much, Iltifat, for, again, setting this all up and helping out the community as you always do, mashallah. Thank you.